Cord blood donation, which has been happening in selective centers around the country for the past 10 years, has created a new resource for patients who are in need of an unrelated donor for transplantation. But we need more donors, and it's very expensive to set up sites as collection sites, which is the model that's operative right now. And so we had the idea that maybe if moms anywhere could donate, not by setting her hospital up as a site, but through a kit that she could partner with her OB or midwife to use, that would allow interested moms to donate all over the country and maybe someday all over the world. So we initiated a pilot with the National Merit Donor Program and two other cord blood banks, one at MD Anderson and one at, in San Antonio at the Texas Blood Center. And we are all together piloting a project to see whether kit donation is feasible. And that really means, can we get enough good cord blood units to put into the bank when moms donate from a remote site? It's going to work really by being mom-initiated, which we think is incredibly important. Moms will contact one of the three banks, either by phone or through their website, to say, I want to be a donor. And then a representative from the bank will call her back and talk with her on the phone and do a small pre-screening questionnaire to make sure that she's eligible. And basically the questionnaire screens to make sure she's having a healthy term baby, that she's only having one baby, because this program is only eligible for moms carrying a single baby, that she and or the baby to be born are not sick with any infections, or that she or her family don't have any risk to transmit an infectious disease or a genetic disease. And if mom passes the questionnaire, then the coordinator at the bank will arrange with her to mail a kit for her OB and or midwife to do the collection. Mom has to recruit her OB or midwife to do this, and I think most will be willing, but they need to know that it's important to get as much cord blood as possible. So they have to use the materials that are provided to them, and they have to take the time, which is somewhere between about 5 and 9 minutes, to really get a good collection. The OB or midwife also has to go online through the NMDP website and take a short training course, and it's about 5 minutes, and it just helps educate them on the key points of how to do a really good cord blood collection. The box that's sent to mom has everything she needs, everything the OB needs to receive the kit, to collect the cord blood, to take a sample of mom's blood, which also needs to be tested, and to send everything back to our bank at Duke. And there's no charge to the mom, to the OB, or anyone else for doing this. Everything is covered through the bank. There's also some paperwork mom has to fill out about her and her family's medical history, and a consent form that mom has to sign giving us permission to put the unit in the bank. Well, our hope is that we enable more moms who we know are out there and want to donate to be able to donate without having to live or near or deliver in a hospital that is officially part of a program. We also hope to recruit more minority donors. These are moms who are not white or Caucasian, because there's a great need in the National Registry to have more minority donors for patients who need transplants. We know that sometimes moms of mixed racial background just aren't delivering in hospitals that collection sites are set up in, but that they are very willing and would donate through this program. Cord blood has really made a big difference in the availability of donors for patients who are in need of transplantation. Only about 20 to 25% of patients actually have a matched donor in their family who can be their match. So for the other 3/4 of the patients who need transplants, they have to look for an unrelated donor. Although the National Registry of Adult Donors, which is about 14 million strong, has many volunteers, when a given patient goes to the registry, they don't have a complete chance of finding a match. And for Caucasians, the chances may be 50%, and for patients of other ethnicities or races, it's much less than that. Cord blood has the unique property of not having to match as close as adult donor cells, and because of that, it can provide donors for people who will never be able to find a full match. It's also available much more quickly than an adult donor, because it's already tested and ready to go, if you will, right after it's banked. And so cord blood transplantation has really filled a niche for patients who can't find a matched donor, even with the limited resources that are available over the last 5 years. And our hope is that with more cord blood units in the bank, that almost all the patients who need a transplant can be served. In addition, cord blood is exciting because it may have potential in the future for other types of therapies in a field we're calling regenerative medicine or cell therapy. And this is only in its infancy, so we don't really know how far this can go. But we know that cord blood cells have some cells that are not blood cells, but cells of other organs that may be able to repair damaged tissue. So we think in the future, these cord bloods that are banked may be used to treat many more diseases than we can really envision today.